bring it out here. Doc, can you give Rosalie and Justin a 10-minute heads up? Coming up.
Rosalie, 10 in the morning, will be here in 10 minutes.
We can move that thing so we come over here.
Dr. J is currently in surgery right now. Dr. J is only second to every day. Patient is having a lot done. She's staying in for a brachioplasty, which is an arm lift, a neck lift, dog ear revision. There's going to be some lipo as well. Lipo to her back, her neck, and her chin. And we are just getting started. We were live earlier for Dr. J's first case. Like mentioned, we are just getting started on Dr. J's second case. We're also on YouTube, so there we are just showing y'all what's happening in the OR. On YouTube, we show the patient's procedures. We will show Dr. Jeneby everything that he's doing. So just to kind of describe what's happening for those of y'all that are joining us on TikTok and can't see. Dr. J got started on this patient's left side. This patient is laying stomach down on the operating table. So for this patient's brachioplasty, that is for arm lift. They got started on her left side. Just remove that excess, that extra skin. This patient has lost a lot of weight. Hey Alex, why is it so loud in the background? Is there somewhere we can see? Yeah, absolutely. We're actually on YouTube today. You can find that in our link tree, or you can look it up in the search bar at Dr. Jeneby Plastic Surgery. But the reason why it's so loud is because, well, one, we have to keep this room a certain temperature. There's a lot of machines in here that make a lot of noise. There's music, there's people communicating, and then, again, the tools that Dr. J has to use.
I know, I'm what?
So Alex, that's why, but again, you can watch this there on YouTube. At Dr. Jeneby Plastic Surgery. Yeah, no problem. What kind of anesthesia is the patient under? Can you give it a wig? Great question. So the patient is under federal and local. For all of the procedures that the patient is having done, like the neck lift, the arm lift, the dog ear revision, all of those things cannot be done always. they usually do patients awake. And this isn't always the case, but it's usually just liposuction. And even when it's just liposuction, it is usually
they want lots of spin on your throat shots, they want minimal spin on the drive.
it is usually broken up into segments. So you'll come in, get some lipo done. So for example, if you're getting lipo 360 done, you'll get the front side done first, and then come back for a second session, get the back side done. Because it's very painful, because you're not getting that local anesthesia. And when you're awake, you can feel it, you can feel everything. It's kind of awkward, you're kind of a little disoriented, you know, it's painful even still, so it's not recommended that you stay awake. It will take a lot longer as well to stay awake, but we do offer some procedures awake. To get more information on that, Alex, you can fill out this form here that I'm about to pin. Once you fill it out and submit it, someone from our team will reach out to you, and from there you can kind of inquire what procedures we can do while you're awake. So like I mentioned, it's usually just going to be lipo, or we can do it's very limited our skill for awake procedures, but you can inquire further by filling out this form. Dr. Jeneby is in surgery right now with second cases. So Dr. J's second cases a day. This patient came in for surgery for a arm lift, a neck lift. She's getting some Renuvion, some dog ear solutions. So from a previous surgery, she's getting some revision to that. That's fine. Also getting some lipo done, lipo to the back, to the neck,
Hey Alexa, play Sirius XM channel 52.
So again, I hope you guys are having a good Monday.
Is this anyone who was on though? Oh, it was? Got a little funky though. Paul's gonna do it.
Are you going to be up here for the back?
Oh yeah, the dog here, yeah, I need to.
You want to do the arm? And you do the dog here?
No, I'll do the arm and do my elbow. The dog here.
Okay.
Special feed out.
And after having been Dr. J is surgery right now with this second patient. This patient came in for a neck lift, a arm lift, some lipo to the back, to the neck, to the chin. Okay, I didn't know that. I
Yeah.
thought you were just I guess what do you call that? Like the coordinator or
Thank you. No. So, it's not it. Today, these days.
nice. Hey, Dr. J,
Hey,
where did you go to school for?
several schools.
I'm sorry?
I went to several schools, college, med school, residency, elementary school, what do you want to know?
Where'd you go for your license?
Okay, let's work backward. Residency was University of Pennsylvania in Philly. Not Penn State.
There you go, absolutely. Where is the class at?
Oh.
7.5.
A lot done today. She came in for a brachioplasty, which is an arm lift. She came in for a neck lift. Revision done to a previous surgery, so she got becoming time done. She's getting a dog feeder station revived. She added on Vernipion, which helps to tighten the skin in areas where liposuction is done. Having lipo
for you, and then make
back, the neck, and the chin. We are going to take a break here in a moment. Come back. We will have to flip her over. So right now she's lying on her stomach. So we'll have to flip her back over on her back so that Dr. J can perform the procedure and the rest of this patient procedure. If you guys have any questions in the meantime, you guys can always visit our website. There is a number that is provided. You guys can always text, give us a call. We also have this form here that can on the bottom of your screen here on TikTok. You can always fill that out and submit it, and then from there, our team will get in contact.
So I was talking to my niece, who's gonna visit JMU, where me and my sister went. And they kicked all the fraternities off the campus and left the sororities.
Why, how do you do that?
They say all fraternities can't be on campus. We have this thing called Greek row. Where I was. I was there for like a year and a half. They did something stupid. Or they were a nuisance. Or they were becoming a nuisance.
Well, usually they aren't on campus anyway, right? They're usually on the streets around the.
No, JMU had a beautiful thing called Greek row. Right there in the middle of the.
In the campus.
Yes.
Where did they were off campus anyway?
Oh, like ugly.
I'm gonna go to Cell Saver. Bonnie's gonna be your hostess for the hostess for the next hour. She's finishing putting in the notes.
Yeah, that's fine. She already knows those. $300 blank.
Sure.
Right? This is Mobile House.
As you can hear, Dr. James doing some lighting now. Let's take it back. We look like that. And Dr. James preparing for the doctor's revision, which is next. Just going to revise where that trauma is. So this patient lost a lot of weight. She had surgery prior to this one. Not sure how long ago.
Oh, Monica is a big one. You have a long triple stitch.
I have surgery for liposuction, but my thyroid level's high. Can I be cleared? That's an excellent question. Hey, Dr. James.
Hey,
This person comments, she has surgery for lipo 360, but her thyroid levels are high. Can she be cleared?
depends on how high they are. Because what our thyroid levels are. If they're just a little bit high, one thing. But if they're like way out of control, then we have to get our thyroid levels done. If they're just above normal, that's one thing. But if they're out of control, like Graves' disease, you can't have surgery.
Gotcha. Yeah, Leo.
Should have an endocrinologist at this point. The guy who's calling her, and I'll ask
Okay.
an endocrinologist.
Hey, Leola. So do you have an endocrinologist that you're seeing? I don't know if you caught everything that Dr. J said. If they're just slightly above normal, you can be cleared. But if they're out of control, then the answer would be no. She said yes, she's on.
Well, we'll have to see.
Okay.
I'm gonna give her an opinion until I see the lab.
So, we can call that Leola can't give a definite answer as to whether or not you could be cleared. However, if Dr. J were to look over your labs, he would be able to give you a more definite answer. Are you already in contact with our team? Sounds like you've already had this surgery booked and scheduled. Dr. J would have to look over those labs before moving forward and before giving you a more definite answer. Hey Alex, I can't find the YouTube channel. Odd, okay. If it wasn't in that link tree, which it should be one of the, should be the bottom tab, I believe, on our link tree. And that should take you right over to our YouTube. However, like I mentioned, you can also search for us at Dr. Jeneby Plastic Surgery on YouTube. It's also linked there on our website. And it's going to have the same profile picture that you see right here on the top. So that makes it a little easier in trying to find us. Let me know if you have any trouble. Looks like this person will be very sore after lipo. Yeah, that's a great observation. I think somebody would be sore after any procedure that they get done, but yeah, with the candela, that tool that Dr. J's holding and using, it's going, it's like right under the skin, suctioning all that fat. So, and the way that it's maneuvered around,
300 upper back.
it can be very sore. That's why we give patients a three-day lasting pain medication, so that way right after their surgery it's not as sore, it's not as painful. Hey, you found us, Alex. Did you find it through the link tree, or did you find it through our can you just search it manually?
I was left upper back.
And so as you can see there on our YouTube, Dr. Jeneby is just doing some liposuction.
You ready?
I gotcha, Alex. Yep. There should be only one of us. And like I said, it's the same profile picture that you see on our TikTok and on our Instagram.
back.
Alright, you guys, we're gonna go ahead and take a break. If in the meantime you guys have any questions, we'd love to get in contact with you and set you guys up with the consultation or figure out pricing, answer all of your questions. You guys can fill out this form here that we have sent you.
I did. I answered everything in 1.5 minutes. And I'm back. Good.
Or you can visit our website and contact us. I hope you guys